Another episode of the Black Surgeons podcast. My name is Dr. Wibonele. I'm joined here with Dr. Oladapo and Dr. Webb. They have both just matched to ophthalmology, and I'm super excited to having them in the podcast just to let us a little bit, to let us know a little bit of their journey and how they got here. So just to get started, why don't you guys introduce yourself a little bit and tell us where you're coming from, what medical school you went to, and where you matched. We can start with Dr. Webb.
Hi. So my name is Khala Webb. I grew up in Baltimore, Maryland, specifically Baltimore City. I went to medical school at Johns Hopkins University here in the city, and I am staying here for residency. So very much homegrown.
Hi, everyone. My name is Oreofe Oladapo. I grew up in Columbia, Maryland, and I went to medical school at Howard University College of Medicine. And I am going to residency at Mount Sinai, New York Eye and Ear
Nice.
Infirmary.
Well, guys, congratulations. This is like a huge, big step of your careers, and I just remember this being probably the most exciting time for me. So, just celebrate and don't take it for granted. So, just to get started briefly, what made you guys pick ophthalmology? Why is the eyeball such an amazing place to work on? And we can start with Dr. Oladapo.
So I actually did not know what ophthalmology was coming into medical school. I actually first heard about it from doing the double AMC's quiz, like based off your personality, what specialty would be good for you. And then ophthalmology came out number one, and I was like, I've never heard of this. So I went on YouTube and looked up some videos. And that's kind of when I first found out that ophthalmology would be a good personality fit. I remember I watched this one video on Med School Insiders, and it talked about the balance of clinic and surgery, and also how cool the organ is as a whole and how we're able to have such a profound impact on quality of life. And I really found ophthalmology intriguing from there. So I explored it further by doing my Howard's ophthalmology interest group and getting involved there, doing community service. And that's when I realized how much of an impact ophthalmology really has on the community and how much the general population really does not know about ophthalmology and things that can affect their eyeballs. Diabetic retinopathy, glaucoma, cataracts, and many of these things affect people of color disproportionately. So I really want to act as an educator in that space and helping to bridge that gap and bridge any inequalities within ophthalmology as well. And also, ophthalmology has a lot of opportunities for global work. And I'm Nigerian, so I hope to be able to have some impact in that space throughout my career. So I think ophthalmology was just a very good blend of everything that I value in a specialty. And it's also super cool.
Nice. Dr. Webb?
So honestly, a lot of I picked ophthalmology for a lot of similar reasons, but I fell into it at a slightly different time. I took a slightly roundabout way to medicine. I didn't discover that I even wanted to be a doctor until late in college, and so I had to take a few gap years just to really have an app have
Mhm.
a pre-med application. Got to the end of college and I was like, "Oh, I need a job because I cannot just be unemployed." That was, like, not an option, and this retina practice in Hagerstown, Maryland, was advertising that they were hiring fresh graduate, like, pre-med students, specifically who were interested in gaining clinical experience. I had no idea what ophthalmology was, but they said that I would get clinical hours, they said that I would work closely with a physician, and they said there was, an opportunity for research, so really that's all I needed, and that it was paid, yeah. I really didn't ask any questions beyond those 4 items, and so I went to the job interview, they were like, "Do you know what we do?" And I was like, "No, but I'll learn, it's gonna be fine." And it was fine, and so I started literally, like, I graduated May, I started there June 1st and was just thrown into the ropes. It was a very high volume retina practice, and they trained you on all the stations. So you start on OCT because that's the easiest to learn, then you graduate to workup, and then you become an injection technician, and then you learn how to, like, fill the charts and set up the injection trays and do the numbing. Then you graduate to fluorescein angiographies, and that's when things really picked up for me. When I saw the dye filling the eye for the very first time, I was like, this is it. This is the prettiest thing that I'll ever see, and there simply can't be anything other than this." Like, and it was just it just clicked. It was beautiful. I loved FAs. I could just be in the FA room all day. So I think I fell in love with the imaging. I fell in love with the anatomy. The patients were amazing. We saw them regularly, especially because it was a retina clinic. We were seeing the patients basically once a month, maybe once every 3 months if they were like successful ILEA patients. But otherwise, we were seeing them every month. And you built these relationships with these people, and they were so happy to see us. And it was just very different from the previous clinical experiences I've had. I had been in like a urgent care setting for a couple months before this, and patients weren't happy to be in an urgent care setting. They didn't want to see you. They weren't happy to be there. But patients showed up to the opto clinic and they were bright and shining. They were like, I love this place. You guys gave me my sight back. You gave me my life back. And so I really did I believed in kind of this idea that we were improving patients' lives, like their quality of life, more so than just extending life for extending life's sake. And that philosophy really resonated with me very deeply. So when I entered medical school, I still had an open mind because I knew ophthalmology was very, very competitive, and that's not my spirit. And so I was like, well, if I just fall in love with anything else that's less competitive, I'm going to do that. But that didn't happen. So I'm here
Nice.
instead.
You guys have amazing stories, both of you. But when it comes to an application for students who are trying to go the path that you guys are going, what does it look like to be a competitive ophthalmology applicant? Especially in you guys' year and the years to follow. Doctor,
Yes, so I think a competitive ophthalmology applicant, most important thing I would probably say is being well-rounded and being passionate about whatever you're passionate about. So when I say well-rounded, this does involve your academics, it involves your community outreach, it involves your ability to write and exemplify your story and give a good personal statement. Your research experiences and being able to contribute to the field of ophthalmology. Ophthalmology is ever evolving. So if that's something you're interested in, that's a great thing to consider. And I'm sure I'm missing a lot of things, but I think as far as your passion, a lot of programs want to see that you want to contribute a certain thing and they want to know what you will bring to the table and how you will contribute to that program and to the community at that program overall. So, for example, with me, I was very passionate about well, I am very passionate about community service as well as mentorship as well as global ophthalmology. So I really kind of tied in how my story relates to these things. I definitely fell in love with ophthalmology, like I mentioned earlier, through doing the community outreach through my interest group and really being able to connect with patients in that way. And also, I have a YouTube channel where I really tap into that mentorship aspect of things, and that's what I'm really passionate about. So, just being able to portray that and really be genuine in who you are is something that makes you competitive. But I would not discount all the other metrics that make somebody competitive for a specialty.
Dr. Webb.
I won't pretend to be an expert because obviously I'm N of one. I don't know behind the scenes how everything panned out. But I approached it similarly to how I approached applying to medical school. I guess I had buckets of like things that were important. So similarly with medical school, your grades, your stats, your like the paper qualifiers, those simply kind of open the door, but they do not get you through the door, if that makes any sense. Like the same way that the MCAT was not going to get you into medical school, that's how I approached my step exams and accumulating research accolades and things. Those things will not secure the residency. At least that didn't feel like that was going to secure the residency. Again, I was not I didn't hear these conversations, but I figured that I needed to score well enough to not be a red flag. And so I think that's really kind of how you should approach your academics and your step exams. Score well enough that you're not disqualified, but understand that a 270 plus is not going to secure you a spot type of thing. And so, you have to put in the work, do the work, keep your head down, do well on the exams. That's kind of like baseline. And then beyond that, I think what Dr. Oladapo was explaining was actually spot on. Is just that you need to have something like authentic to yourself, some reason that you're doing this, some common theme, some story that makes sense across all your activities. And that was the same with medical, with when I was applying to medical school. my same theme I carried on because I stayed the same person. It's not like I turned into a different person in 4 years, right? Like you care about the things that you care about coming in, and you should care about them leaving unless something crazy happened. And so I think building on what you say that you cared about when you came into medical school, find a way, specialty specific way for your activities to now fit into that mold. So if I came in and I said, which I do really care about education and mentorship. I was a teacher in a past life and I've done like a lot of teaching and mentoring throughout my life. When I was thinking about how to demonstrate that I was interested in ophthalmology, I kept those things in mind, like because I still wanted to enjoy the things that I was doing while resume building. And so whenever I was involved in community outreach, I was the medical student trainer or educator for the other medical students to learn how to do the screenings, or I was involved in education research. The things that you do, yes, they're kind of checklisty. Yes, you have to do research. Yes, you have to do some type of community outreach. Yes, you have to, right, like show that you like this field, but it can always fit within what you are actually interested in at a core level outside of medicine. And then that makes it really easy to write your application and to actually care about it when you're talking about it in
Nice.
interviews.
I think this might apply more to Dr. Oladapo. How early should a student start preparing for the math, especially if they kind of found ophthalmology pretty late? Let's say you're on your third year and all of a sudden you're like, oh man, I didn't even realize this was a thing. How can they be competitive in that situation?
I think the answer regardless I wouldn't say I found out
Mm,
about ophthalmology late because I found out, like, right
oh,
at
I
the
see.
beginning of my first year of medical school. However, regardless, I do think for anybody trying to do any competitive specialty, the answer to that question is as soon as you realize
Mm,
that's where your heart's at. Because I I do think one lie that people tell medical students is that, "Oh, you'll don't worry about it. You can figure out an however, if you can expose yourself earlier, you're at an advantage because now you have more time to work on research. Now you have time to start building that application. But if you do find out late, same thing. I think having a good academic background, regardless of your interests throughout medical school, is something that'll help you. You can't go back and change your test scores. You can't go back and change your grades. However, having that strong foundation and showing, hey, I can work hard in general, no matter my interests, and then being able to, now reach out to people in ophthalmology, expose yourself, shadow, get involved in whatever research you can, doing those things whenever you find out that that's what you want to pursue. I think that's the best way to go about it.
Dr. Webb, how did you approach away rotations? Do you think they're a good idea? Do you think people should do them? And because some people are saying, oh, don't do away rotations. If you have good scores, you have good letters, that's just a way for you to get in there, and then you might show something bad, and then they're not going to match you. How was your approach for away rotations?
Do you think that I don't think there's a one size fits all for away rotations. I personally did not do any away rotations, but it was because I was fully anticipating on shooting for my home institution anyway, right? So I had already done electives at my home institution, and I knew that I was likely going to rank them either one or top 3. I mean, I didn't know before the interview trail, but I knew that somewhere in me, Hopkins was top of my list. And so there was really no reason for me to do away rotations. However, some of my classmates did do away rotations because Hopkins wasn't their number one, and they knew that they needed to be in a very specific location for significant other or for other type of some other reason they needed to be somewhere else. They did an away rotation at an institution in a location where they were really interested in pursuing. But even then, a lot of my classmates didn't do away rotations, even though they really wanted to end up like in California. And so I really think it should be case by case. I think your institution matters a lot. Unfortunately, if you do not have a home institution, an away rotation is like a necessity because how else would you get an ophthalmology letter? But if your institution has a home program, and if you were able to perform well and find someone who will vouch for you at your home program, then an away rotation may not be necessary. But, you have to do some soul searching. Did I put my best foot forward while I did my electives at home? Are there physicians here who would actually advocate for me behind the scenes? And if you can't confidently answer yes to both of those questions, then you probably should consider away rotations. And I know they're expensive. So really, I think only do it if necessary type. That's at least how I approached it. And that's why I didn't do any.
What about you, Dr. Oladapo?
Yeah, so I actually did one away rotation, and Howard also has a home ophthalmology program, so I did that ophthalmology rotation as well. I actually did my away rotation where Dr. Webb is at Wilmer. But I kind of went with the approach of doing the away rotation because I genuinely wanted to see if that program would be a good fit for me. What do I call them? The people who are also the Howard Med students
Mm-hmm.
who applied with me, we all did away rotations, and I believe one other person did one, and then the other person did two away rotations. But I think if you don't have a home program, not only would I say away rotations are a necessity, but I would say you should actually do multiple,
Mm,
like two or three, at least one rotation to kind of build your foundation, build up those skills regarding ophthalmology, because ophthalmology has a lot of little techniques and things that you need to learn. And then doing more rotations can help you actually have the opportunity to show off those skills and to be able to build relationships with the people there. I will say I did not get an interview where I did my away rotation, but I still think it was a great, valuable experience for me to be able to learn more and even just see how ophthalmology works in a different clinical setting. And I do think it was a good experience overall. So you can look at it from that lens, but also remember away rotations are expensive. However, there are systems that have scholarships, especially for people of color. I'm interested in ophthalmology. You can look at the FARMS database. I think it's just farmsdatabase.com. That has all of the programs that have scholarships by each subspecialty. So I would definitely check that out to see if you can find scholarships for the away rotations as well.
nice. And so, I want to move on to step scores, because I feel like now, when I was going through step one was scored and step two was scored. Sounds like for you guys, step one is pass fail, and that used to be a big metric back in the day. It's like step one or bust, right? How do you guys think scores influence your ability to one get interview or your ability to match? And what's your recommendation about taking step too early so that it can be part of your application, or is it even required nowadays to take step two before you're applying? I'm not sure, but you guys can let me know that. Dr. Webb, we can start with you.
Okay. This is another one where I'm just guessing because I wasn't behind the scenes, right? Like, I don't actually know how they weighed our step scores. However, the data shows us that there is an average step score that matches, and it's different from the average step score that does not match. So, at some level, it must matter. I don't know. I honestly don't know how much, but I would approach it the same exact way that you approach the MCAT. Aim for the highest possible score that you can get. Instead of like shooting for a specific number, just do as well as you can. The goalpost, unfortunately, is going to continue to move. I don't know where it's going to be in 10 years, even. But for right now, I know that like aiming for the 250s, mid 250s was like considered safe. And not that anything's really safe these days, but mid 250s didn't close doors. And so, but I don't know that I would aim for mid 250s. I would just aim for, can I score as high, like what is the highest possible score that I can get within the number of dedicated weeks that my school allows me to have, and just go from there. The same way when I was taking the MCAT, I didn't like shoot for a two, even were the numbers 515 or higher was like good enough. I just like went for whatever I could get, and but I would absolutely take it before you apply. I actually don't know what the rules are because everyone who applied with me took it before they applied. My understanding is it has to be in before like you match, obviously, but I don't know like where in the timeline is the actual deadline. I'm sure there is a sheet somewhere telling you what the deadline is, and programs might have different deadlines. To be on the safe side, I would just take it before you apply, and take as many weeks of dedicated as your school will offer you, and really just put your best foot forward. It is the one standardized metric on the application. And so programs absolutely look at it. Yeah. I don't know. Do with that what you will. I know everyone has different opinions on test taking, and it's like whether or not we should use it. But the fact is we are using it. Since we are using it, I think you should just try your very best and get as high as you can. But yeah, Mid 250s is what I was told for now, but in 5 years, it might be mid 260s. Who knows? I don't know.
Dr. Oladapo, what do you think?
So I think I can kind of weigh in on this a little bit more because I was in a unique situation taking step two, where I only really had a week and a half to study for it. Because at Howard, we end our rotations in July for M3, and I had to do my July August block. I had to do my home ophthalmology rotation in order to get a letter of recommendation. So I didn't have the opportunity to take out a dedicated study period. Some of my classmates actually just delayed their step two and they actually did not submit it for that. When do we have to submit? Like September 1st. They didn't submit their step two score until later. They were still able to get interviews. And one of my other classmates actually still took the dedicated month and just chose to do her home ophthalmology rotation later. So I think you don't have to get the score in by a certain time, but I do think the fact that I pushed through and just took the tests early um, helped me. But I think I wouldn't have been able to do that if I didn't go in with a solid foundation by doing well on my shelf exams prior. So I think that gave me the opportunity to be able to score decently in the mid 250s in order to become competitive for the application process. However, I would, if you have the opportunity to take it dedicated, I definitely would do it because I would say it is a metric that people look at. I actually think the AUPO just came out saying that the average is 255 for matched applicants and 242 for unmatched applicants. So there is a difference there. So it's better to open doors than to close them. So that's how I would go
Nice.
about it.
That's a good advice. And I know the ophthalmology match is different from everybody else, right? You guys have your own match, and the submission is usually early, right? Can you guys kind of weigh in on that a little bit?
Yes. Yeah, so we use the SF Match application system, the San Francisco Match, versus using the ERAS system, which most specialties use. So we have to submit our applications. It varies by program, but the application deadline tends to be August 30th, August 31st, September 1st, September 2nd, around that week. So it's better to just get it in by the end of August.
So moving forward, as far as like getting letters of recommendations, right? I think that's another important metric to get you in the door. How did you guys approach that? And did you just get from your mentors from your home institution? Did you try to find other like your away rotation, for example, or did you try to get like medicine letters of recommendations to go with your ophthalmology application? What's your advice on that, Dr.
Sure. There are basically two schools of thought here within ophthalmology. You could either do three ophthalmology letters, or you could do two ophtho letters and then one letter from your sub-I. Most people do a medicine sub-internship, so they would do like two ophtho letters and medicine letter. Some people do a surgery sub-I, so they might get a surgery letter. Or you could just choose a rotation where you really shined. I mean, I've seen someone use a pediatrics letter from a core rotation. But the idea is you need to have someone who can speak to your interest in ophthalmology, so that's kind of where your ophtho letters come from, and then someone who can speak to your clinical skills, which is why some people will choose to do a medicine letter instead of an ophtho letter. Ophtho is one of the few specialties where, as a medical student, you don't really have many places where you can shine clinically because the clinical skills are just so niche that you usually learn them as a resident. And there are very few clinics where you'd be able to just walk in, take the doc's patients, work them up on your own, present it to the physician, and then see the patient again. I was able to do that in like 1 week of the 8 weeks of elective that I took for ophthalmology, right? And so since there are just so few opportunities to do that, you it would be hard for your ophtho mentors to speak to your kind of clinical diagnostic skills in the same way that a sub-internship, like, physician or attending would have been able to speak to it. And so that's kind of like the idea of why you may not get 3 ophtho letters. However, if you have 3 ophthalmology mentors and you were able to work up their patients or were able to demonstrate some type of clinical or surgical acumens throughout your time working with them, it's totally fine just to do the 3 ophtho letters, and they speak to your clinical and ophthalmology kind of interests. I personally did 1 sub-internship, like, medicine letter and then 2 ophtho letters. With my ophtho mentors, I got lucky. Hopkins has a humongous department of attendings. I mean, it's like insane. We have I don't know, I don't even know the number, but like more than a handful of every single subspecialty. And so it was easy to find people that you really click with and work with them longitudinally. And so the mentors I chose were the mentors that I spent the most time with, the mentors that I did the most projects with, the mentors that knew me personally, like had dinner with me and my husband, right? Like these
Mm,
were people that you know and people who are willing to go to bat for you because they do call your letter writers. I like found that out the grapevine. They're calling them. So you want someone writing your letter who knows you personally. And I think that is more important than just like picking the best publication on your list and trying to get that specific mentor to write your letter. That's not the move. What you're just gonna set yourself up for failure because they don't really know you that well. So when they call, they're gonna be kind of lukewarm and it's just not worth it. Pick the people who know you the best, who can speak to your reliability, to your curiosity, your intelligence, like all the things that will make you a good resident because they spent the time with you and not just because they know of a concept of you because you kind of like half wrote their paper, you know?
nice. Dr. Oladapo, anything to add on that? Letters?
Yes, I definitely agree with Dr. Webb. I approached it slightly differently. So I wanted to show my work ethic and my personality through different facets. So I did two ophthalmology letters and one letter from my surgery core rotation, actually. And I definitely chose to do it with people who I worked closely with and who can really speak to who I am and what my values are and what I can bring to the table. So for my two ophthalmology letters, one of them was from the chair of the ophthalmology department at Howard. And I actually did some research projects with her throughout my M3 year. And then in addition, doing the ophthalmology home rotation definitely helped. Fortunately, I was in a program where med students got a little bit of autonomy where we got to kind of work up the patients and try and form our own differentials, but also really being able to show on that rotation my passion, my willingness to learn. I think a lot of people are really looking for teachability at the end of the day and somebody who's really willing to put in the work. So I was able to build that relationship and have that letter of recommendation. And I often like heard her, she would call me and be like, "Oh, somebody told me that you had a good interview with them." So people definitely talk to each other. My second ophthalmology rotation was actually from somebody who I did research with. So during the summer after my M1 year, I was in the Wilmer Diversity Scholars Program. So I got a letter from my research mentor through that, who I not only worked with during that summer, but I also worked with for my whole M2 and M3 years doing a research project. And I also was able to shadow this person during that summer. So he was able to speak not only to my work ethic as a researcher, but also to how I can interact in a clinical setting, my curiosity, and things like that. And my surgery letter was able to speak to some of my clinical acumen as well as surgical skills and potential and willingness to
Nice.
learn as well.
I think, yeah, that's really good advice. Just I think one of the things that when I was coming about was making sure that you have people who really, really know you. You just don't want to, because usually people would write on your letter, like, this is one of the top whatever student I've worked with, right? But if somebody doesn't care or they barely know you, they can never really mention those things. And those are the things that stand out usually when people read your letter. So those are really, really, really good advice.
One of my letter writers, I spent like an entire month in a
Nice.
different country with them. Like it was just me, him,
Mm.
and one other med student. And it's so funny because we had multiple conversations about my career goals, but I didn't tell him like, oh, write about my career goals in my letter. And so during one of my interviews, they were like, oh, where do you see yourself within academics in XYZ years? And I was like, one day I'd really like to be a residency program director. Like that's something I think about. And they were like, "Oh, your letter writer wrote that you would be an excellent program director. Do you guys coordinate that?" And I was like, "No, why did he write that? I told him that I'm trying to get into residency. Like, why is he talking about a program coordinating?" And so I think that's what I'm trying to get at. Like, they should know you personally. They should know what you are interested in, what you like, what your goals are, so that you don't have to rehearse, you don't have to coordinate these things. They'll just fall into place
Yeah,
naturally because they
yeah.
are true,
And,
you know?
and so, speaking on that, how do you somebody actually find these kind of mentorships, right? Like, you know, for example, I went to Morehouse School of Medicine. We don't have any ophthalmology department, right? We don't have an ENT department. I had to go out of the way for me to find ENT mentorships. But how? for a student who's struggling to do this, what other ways can they kind of get connected and plugged in so that they can have a successful match?
Yeah. I think that's where a lot of outreach programs really gain value here. So there are a few programs that I participated in for ophthalmology. There's the Minority Ophthalmology Mentoring Program. Wait, it was renamed recently. I can't remember.
The vision program. I
Yes,
don't remember what it stands for, but yeah.
yes, the Vision program, but it's run through the Academy of Ophthalmology, the American Academy of Ophthalmology. That you apply, so you have to know you want to do ophthalmology fairly early for that one because they want you to apply in your like first year of med school or maybe even before your first year of med school now. It's like designed for when you hit the ground running like in medical school, your first year you're already doing programming with them, but they supply mentorship. They like sponsor you to go to the academy meeting in your first year. And that's where you can do a lot of networking. Another good program is the Rab Venable program. That one does require that you already had at least one mentor kind of coming in because you would submit research to the program and then you would present your research through the program. They would pay for you to go to the NMA conference. And so that one you kind of had to do a little bit of like beforehand. You would have had to do at least some semblance of something ophthalmology research related to get in, whereas the vision program, you would just apply with nothing, right? Like you're just a blank slate. Both of them were really, really great. They both provide with mentorship, networking opportunities. They both sponsor you to go to these expensive meetings. They like cover your travel expenses and things. And I think that's if you don't have an ophtho program, that's kind of where you put your foot in the door. And so you'll do your networking in these places. You can figure out who is working on what projects and whether or not they need help. And then after the meetings, you would either try to hop onto a research project and hopefully you build a relationship with them. One that when it's time to start doing away rotations, they'd be happy to have you work with them at their institution. And then they can see you both in a research setting and a clinical setting, right? Like it should organically grow from whatever connections you make at these meetings and you would try to maintain that relationship. I think that's the hardest part is you make the connection, sure, but trying to actually stay in touch with them in a meaningful way over the course of a few years, that's kind of the hard part. And that's where you have to do a lot of legwork. I'm not saying to just keep doing projects that they're feeding you if you're not like super interested in them. But even if you do a project with them and you're like, you know what, I'm good. Like, still keep them in mind for, well, I'm going to be in this city at this time. Maybe I can come by your clinic. Maybe I can, see this surgery or something. Just kind of stay in touch.
Anything to add, Dr. Oladapo?
Yes, I definitely agree with the conferences, the Mom Vision program, and the Rab Venable. And for Rab Venable, you actually could apply as an observer for 1 year, which is what I did for my M3 year when I didn't have anything to submit at the time. So with that, they may not sponsor you to go to the conference every time. However, you are able to go to the fireside chats, which are virtual, and you get to literally talk to different program directors for different ophthalmology programs. And another thing I would add is to not be afraid to reach out to whoever is within your network who is remotely tied to ophthalmology in any way. That includes anybody coming before you who matched ophthalmology from your medical school. I am sure they will be happy to help you out because they know your exact position of not having many people to reach out to. But now that they're in ophthalmology, they probably have a whole nother network that they can connect you with. And also, cold emailing people, I think it's fine. They may not always reply, but you never know who you're going to be able to build a connection with. So really don't be afraid to just put yourself out there. I have people cold email and message me all the time, and I'm happy to chat with them about things. So really just try and build whatever you can get in the situation where you don't have that. And even just looking up for local ophthalmologists in your community who may be at nearby institutions or maybe in private practice and seeing in what ways you can get involved, even if it's not through
Yeah,
conferences.
that's a good point actually you're bringing. Sometimes just reaching out to people and saying, "Hey, I'm interested in this. How can you help me?" And you never know. Maybe they know somebody who knows somebody else who can help you. So most of us really want to help, right? Like there's nobody out there who's just like, I don't want to help anybody. Everybody else wants to pull somebody else up because we wouldn't be here without a whole bunch of people who came before us. So don't be afraid to reach out to people. Don't be afraid to email people, DM people, maybe a couple times. After a couple times, if they're not replying, be like, cool. Usually for me, it's like you might DM me once, maybe I was busy, but like if you can DM me again, I'm cool with that because I just know you guys are gonna see intern year. Life gets a little busy, so sometimes you're not gonna be able to reply to things, but people are always willing to help. So make sure you're just reaching out. When it comes to personal statement, what are the most important things to include in there? I think we kind of highlighted on this a little bit about telling your story and, make sure that kind of displays who you are and what goals you have. But what are the things that people should make sure to mention, especially for ophthalmology, and what are the do's and don'ts?
So, as far as personal statements, I would briefly touch on something in your background that kind of indicates how you got into medicine in the first place, and then elaborate on your journey to ophthalmology and through ophthalmology, and where you feel your purpose lies within ophthalmology and how you plan to contribute to the field. And also, if you can find ways to highlight some of your assets as well, why you think you would be a good fit for whatever program you're applying for and why they should want you. I talked a little bit about my experience in Nigeria. I went to the boarding school in Nigeria for about a year, and I had a lot of issues there. I feel like I wasn't really advocated for, even if I was going through some health issues while I was there, and how that kind of fueled my passion to want to serve underserved people and people who are marginalized and overlooked. And that's kind of something that stemmed my interest in medicine overall. And then having the overlapping interest in science got me into medicine. And then I kind of just talked about how I know what I wanted to do, but I started just doing research on different specialties, found ophthalmology, and then I talked about my journey and development as a ophthalmologist to be, my community service outreach, as well as how my research experience kind of ties into my passion and how I view research as a form of service as well. And I also just kind of touched on my interest in microsurgery and how I really want to educate patients and help combat disparities through all the work that I do. So I really just kind of showed what my motivations are and what my passions are, as well as how I got to where I am and where I want to go. As far as do's and don'ts, do have people review it. I literally, the personal statement I started with and the one I finished with are very different. I may have actually had too many people review it. I had like 7 people review it. But I think everybody gave me a little piece and little nuggets on how I can improve it, and I think that really helped me to make the autobiographical sketch that I needed. And I do wanna note for ophthalmology, it's a little different compared to ERAS in that we actually have 3 essays. So we have the autobiographical sketch, which I believe is meant to be about 500 words max, and then we have 2 short essays, and we can choose from 4 different prompts. The short essays are meant to be 250 words each. So that's a little variation with ophthalmology.
Dr. Webb?
Okay. Yes, I agree with everything that's been said up until this point. I think I really love the personal statement. I think it's a very unique opportunity to make a chronological kind of arrangement. Like, how did you get from point A to point B? Because the rest of your application is very fragmented. You're kind of just like listing out the things you've done. You have your publications there, your scores are there, but it's kind of all jumbled, whereas the personal statement allows you to run someone through, okay, where did you start and how did you get to where you are and why are you trying to go where you're saying you're trying to go? And I spent some time this past year on the admissions committee for my medical school for like pre-meds trying to gain admission to Hopkins. And I will say that I spent a lot of time reading people's personal statements more so than I did reading the other parts of their application. So I can only assume if I do become part of the residency selection committee, that I'll probably do the same thing. And maybe that's what they're doing. I don't know. But I really appreciated seeing, okay, how is this person, how organically, why are they doing this? And so I thought that the personal statement was a great place for you to say where you've come from. I spent a little bit of time. The reason I didn't decide to do medicine until late in college is because I thought I wanted to be a veterinarian at first. And so I spent a little bit of time explaining how I made that switch from vet medicine to human medicine. And I actually like bonded with a lot of my interviewers. There has to be a study on like the vet to med pipeline because a lot of my interviewers thought they wanted to be veterinarians as well. One of my interviewers even went to vet school. It was like a whole thing. But anyway, I spent a lot of time like, in my interviews talking with people about this. And then I explained like exactly how or why medicine was the better option. And it helped. And it was a nice way of me explaining why medicine in general, but like showing I had actually considered alternatives. So this is not just something I did on a whim. And then of course you explain how you discovered ophthalmology, what within ophthalmology attracted you, the things. And I think what makes the SF match system really special is are those two essays that you have to do after your autobiographical sketch. You have an option of four. There are like four options, and you choose the two that resonate with you the most. And I think it allows you a very unique opportunity to tailor this and really like show where you shine. And so for me, I had a lot of distance traveled. I mean, I grew up dirt poor in Baltimore City, like poor, poor. And so there was an essay about, explain what resilience means to you and how you've demonstrated this. And I feel that my story really catered well to that. And so of course I chose that essay. And then there was another essay about how you would contribute to the diversity within like the residency class or so. I can't remember the exact wording, but obviously, like, obviously, come on. Like, that also made sense. So, I think it's just even the questions that you decide to answer can work for you. And so, I don't know, I just felt it was very nice, like, for personal branding and for sharing a story that would be unique and that would differentiate you from your peers. It's, like, the perfect place to do that. More so than, like, other places. And then the things to avoid, I would avoid making this just a narration of your resume. They have seen what you've done. They've seen your publications. You wrote down your hours for, like, what you did when you were volunteering. Like, they know these things. This is where you explain why you did those things, right? Like, I don't wanna just read that you went abroad and you did these things. I wanna read why did you go abroad? Why did you choose that country? What did you hope to gain out of that? Like, how did that fuel how you plan to practice in the future? Like, this is the explanation part. This is not the listing phase. If I see listing, I usually stop reading, at least when I was reviewing like pre-med apps. So yeah, don't do that. Oh, and avoid very cheesy eye cliche, something the eyes are the window to the soul. Like, don't do that. No puns, unless they are like, this is the most unique pun. They've never read this before. They would just zone out. So don't do
The
that.
eyes are the window to the brain. That's why I'm just kidding. Don't write that either.
You might have got one person with that.
Anything else to add, Dr. Oladapo? Or you feel like we covered that pretty well?
But yeah, as far as don'ts, really make sure that you don't have any typos because I've heard that that can just be a turn off. Even if you're making the most beautiful story, I don't know, Dr. Webb can weigh in, but I've heard it can be a turn off. And very heavy on the don'ts, just repeat your CV. I think this is your opportunity to really highlight which of your experiences are most important to you and which ones you really feel shape you. Be selective as far as what you talk about and make sure that what you're talking about can come together in a story to fit your overall theme of what you are trying to convey to the reader of who you are and what you're about.
That's pretty well said. So when it comes to interviews, you got your scores, you got your personal statement, your research is in there. Actually, I think I've skipped a little bit of research. How important is research when it comes to applying to ophthalmology? Do you need to have it? Should it be in ophthalmology? Can it be in something else? And what do you guys think about that one?
So, my story with research is a little bit iffy because I definitely did have research experience, but I had a lot less than the average ophthalmology applicant, and that kind of intimidated me from applying. I considered taking a research year. However, I didn't feel like research truly resonated with my exact passion. I do like doing research that I do care about, and I think is actually contributing to what I value, such as research regarding disparities and access to care, because that's what I feel is really contributing towards how I want to impact the world. However, research for the sake of research just didn't resonate right with me. So I actually did not have a single full publication upon applying. So that very much scared me. However, I was still able to get interviews. I had about 5 presentations, I think. I was still able to get interviews. And as long as you really know the research that you did do, and you're able to talk about it and talk about its impact and show that you know what's going on and that you weren't just kind of floating on the sidelines or something like that. I think that's what's really important, being able to communicate about the research that you did do. I think that depends on when you decided on getting into ophthalmology. It's good to have research in anything. Like if you were gung ho orthopedic surgery and then in M3 you switch to ophthalmology, they're going to be happy to see that orthopedic surgery research that you have because it shows that you understand the research process and that you're able to see a project through, which is something that they're looking for. However, if you do have ophthalmology research, that's probably what they're going to talk about primarily. For example, I did some research in undergrad, but nobody asked me anything about it. I was only asked about my ophthalmology research in my interviews. So if you can get ophthalmology research, it's definitely up.
Dr. Webb, what do you think?
Yeah, I would echo basically everything that was just said. I also was not a research powerhouse, which was very intimidating because I come from a research institution, as we all know. And a lot of my classmates had a lot of research, so um, I felt behind the curve for sure. However, my mentors reassured me throughout the entire process. They were like, "Look, you just need one." They maintain they're like, "Look, you just," because I think we are in a research arms race right now with residency applications, and people just the number just keeps going up and up and up, and there has to be a ceiling at some point. At least that's what I tell myself. But my mentors, they were like, "Look, this is not a core part of your narrative, and so you just need one. You need to demonstrate that you can do it. You need to demonstrate that you care about something, some academic interest within ophthalmology, and research is the way that you show that. But you don't need to show it excessively. You just need to do it once, do it well, and be able to talk about it in interviews," as Dr. Oladapo was saying. So I had literally one publication going into my application cycle. I had done like 3 different projects, but only one went to a publication. And I had done, I don't know, maybe 6 presentations, like posters/presentation. Maybe 2 were presentations and then like 4 were posters. And so it looked like a lot on paper, but it was one completed project and it was enough. And it was enough. Like I never was asked during an interview trail like why I didn't have more publications. They just asked me about my publication and they were happy to talk about the one publication. And it was okay. I didn't feel like I needed more. I didn't feel like I needed to take a research year. I will say that I agree that whether or not you do ophtho research definitely depends on when you decide ophtho. Programs are not stupid. Like if you tell them that you decided ophtho in your 3rd year, they're not expecting your first year research to be ophtho, like naturally, right? And so I think it just depends on what your narrative is. If you are a late discoverer, then it's going to make sense that you didn't do ophtho research until the summer that you applied. But if you're saying that you came in and you knew you were ophtho and you have no ophtho projects, yeah, what are you doing? So yeah, just make it make sense for like your narrative and who you are as a
Yeah,
person.
that's a very good advice. And so now let's move on to interviews. How did you guys prepare for that? And how many places did you interview? And how did you pick places to interview? Dr. Webb, we can start with you on that one.
Yes. Ophtho is like actually really like our system. We have an interview cap. So no one can take more than
Oh, wow,
15 interviews, which I think,
that's
yeah,
cool.
honestly, I
Yeah.
love this system. It prevents people from boarding interviews at places that they really are not considering. And I think it really like, I don't know, it's very equitable in my opinion, but maybe others have different opinions. That's mine. I took the maximum of 15 interviews because I physically could not do anymore. Like they will not allow you to schedule it in the system. And they also started signaling last year. So we got 7 signals where they were all the same weight. There were no gold or silver. They were just a signal was a signal. And so you could send a signal to your top 7 programs that you really wanted an interview from. So my interviews consisted of I got interviews for all of my 7 signal, like every place that I signaled, I got an interview. And then I got various interviews from other programs as well. I actually got I can't remember, I think it was around 20 interview invites, maybe 20 or 21 interview invites. And so I had to turn down 5 or 6 programs. And I think that is where you really like sit down with yourself and like, okay, where would I actually go? Let's be so for real. luckily, a lot of the interviews come out around the same time. It's not the exact same time, but within the same, like, 4-week period, most of your interviews come. And so you know where else you have to go, or if you're still waiting on a signal, because for some reason, my signals all release their interviews super late. And so you know, like, okay, well, if I know that I'm waiting on 3 of my signals, I should probably leave, like, 3 interview dates open, or I would schedule something and cancel it as soon as I knew that my signal was coming in so that it would open up a spot for someone else. But, yeah, so that was a very long-winded way of saying that I did 15 interviews. When I was doing them, they were all very similar. I will say that the interview formats were very similar. They were, like, short, kind of personal one-on-one interviews. I only had maybe 1 or 2, like, large panel interviews, but most of the time it was 2 to 3 interviewers asking you questions about your resume or your application. It was like it there were crazy surprises. There were some situational awareness type questions like, "You're in clinic and your co-resident is really struggling, and what do you do?" There were a few oddballs. For the most part, I felt like it was kind of garden variety, like, normal interview questions, but maybe I just had a very nice experience and yeah, so
Yeah, to God up.
Yeah, so as far as interviews, I also did 15. I received about 22 invites, I believe, and some of them were trickle invites. So I didn't receive all of them within that 4 weeks. Sometimes I got them later. And I do really also like the 15 cap because honestly, I was tired by the by the end of December. I don't think I would have been able to do all 22 interviews. There is a document somewhere floating around that shows kind of when each program is likely to do its interviews. So I tried to schedule my interviews for programs I really cared about for dates that aren't popular dates. For whatever reason, everyone wanted to do an interview on December 5th and December 6th.
yeah,
And actually, the interview that I did on December 6th is where I matched. So I'm glad I chose where I chose to do it. But
that's so funny.
as far as signals, I actually matched somewhere where I did not signal. So I'm glad I still gave this program an opportunity, and I really did fall in love with the program as well. So as far as how many interviews I got from signaled programs, I believe I got 4 of the 7 programs I signaled, and I kind of did 'em like maybe 1 reach program and then like 4 target programs and then 2 safety programs. But in ophthalmology, you really quickly realize there's no such thing as a safety because it's ophthalmology, and some of those programs I didn't get the signal were from the safety programs that I signaled. As far as my actual interview experience, is kind of a blur because it was just a lot in one period of time. However, as far as the questions I got, there were a few basic questions, but I really think people were just trying to get to know me. However, there were a couple times I got questions as far as like clinical knowledge. Maybe that happened 3 times where I would be asked about some situations and talking about different patient cases. And then you would get pimped on whatever the management of whatever you just talked about is.
That girl what?
You didn't have that? So, well, now you know, be prepared for anything. And if you talk about something, you better know everything about what you're talking about because they are well within your rights to ask you. So, yeah, I definitely gave a patient case once, and then they asked me about the different diagnostic criteria, and I didn't know. So, that was my first interview.
No.
Yeah, it's okay. We live, we learn. So, just be aware of that. And yeah, people do really just want to get to know you. Most of them were nice. I found most of them were 15-minute breakout sessions, and it might be like 4 to 7 breakout rooms.
Mhm.
I found more of them to be like 2 to 1, like 2 interviewers and then me. I think if it were with the program director or the chair, it would be one-on-one. And I think the most amount of people who I had in an interview room was about 7, whereas a whole bunch of people throwing different questions at me. But, the formats vary, and yeah, overall, the interview trail was pretty good, and I'm glad that it's over because it was a long process, but I'm just glad to have gone through it and been able to get to know so
Did
many
you
different
guys
programs.
do virtual or were they all in person? How was okay,
All
okay,
all
good.
virtual with
Okay.
ophthalmology.
We thank
I
God.
interviewed
Yes.
21 places and I had to go to like all of them. So
Wow.
I'm sorry, you went to 21 in-person interviews? How much money did
a
you
lot
That
of
spend?
sounds
money. That was what we had
expensive.
to do back then. Like with DNT is like, the percentage to match is like super hard. So you just like, I got an interview, I gotta get it. Um, so yeah,
Wow.
it was an expensive experience. So I'm glad that. I'm
Yeah, I
glad
Yeah.
they
think
switched to
yeah.
all virtual now. I think some of the programs are still doing in person. I think they went back. Yeah.
Yes. For some surgery, yeah, I know for sure, like, my surgery friends were definitely going to in person. Like, my gen surg friends were definitely going to
Yeah,
interviews,
like neurosurgery too. But I think ophthalmology makes it standard, like we are not allowed to do
Nice.
them in person. So
which
I
is
Yeah.
appreciate it.
amazing, it's amazing. I was pinching pennies trying not to like, so the average amount of programs that people apply to last year, I think was in the 80s somewhere, and
Yeah.
I was pinching pennies even with that. I only applied to 50 programs, and even that, I was like, "Why am I applying to this many programs?" So, I could not imagine if I had to
Yeah.
actually travel. Yeah, that
Yeah.
would've
I
been
mean,
Yeah. I really like these two.
I
Oh,
mean,
sorry,
at
go
the end
ahead.
of the day, it's a little bit of a business if you think about it, because it's like all of these medical students want to match somewhere. And if you're applying, they're going to apply to as many as they can. That's money in, right? And then if you get an interview, you want to go to maximize your chances because you just never know, right? Like you don't know the future. Yeah, at least for that time, that was my case. So that's good to hear that, because if you think about it from equity standpoint and some people don't, you can't have the money. Like, you had to take more loans to go to these things, right? And so, like, that's more of a burden for some people for sure. So, but anyways, it's not about me. When it comes to your rank list, what factors do you guys kind of prioritize for your rank? And I know, Dr. Webb, you wanted to stay home. So I guess what other things did you factor in there when it comes to making your whole list?
yeah. I will say location was definitely up there. You know what's so funny is if I wasn't going to be in my city, I actually preferred, like, a suburban or a southern, Midwest, like a slower kind of pace. So I was like I either wanted to stick with the city I knew or not really go to a city at all. So the programs that ended up, like, ranked highly, I had Duke 2nd because North Carolina is, like, this cute little suburban kinda area. Then I had Michigan 3rd. Michigan, similar like, Ann Arbor is, like, a cute kind of suburban feel. So the location ended up mattering a lot because I figured wherever I did residency, I might stick around, and so I was thinking about, like, family planning after residency and just like life things. I'm also married, and my husband and I, we own our house in Baltimore City. So I was thinking about like, we've been very spoiled as homeowners, and I know he wanted to own again. And so I didn't even apply I think I applied to one place in New York, but didn't even they offered me an interview, and I realized I actually was so unserious and did not even take the interview. Like, I couldn't imagine trying to live in New York. I didn't apply to any programs in California, like, really high cost of living places. I just didn't apply because I knew that we might wanna buy a house, we might wanna kinda do things outside of residency that required the city to not be super expensive. After location, I looked at subspecialty kind of representation. I don't know what subspecialty I want to do, but I know that I probably will do a fellowship. And so I looked at how big are their departments? Do they have a person for all the different subspecialties that if I decide I want to do this kind of like less represented subspecialty, will there be an attending there that could kind of help me through that? I looked at salary and benefits and things like that. Like I just like, let's be so for real. There was one program that was in a very high cost of living area and their salary was like 60,000 and it just was not making sense. And so definitely looked at like cost of living versus salary just to see what kind of quality of life I would be able to have. And I'd say the last thing I looked at was like setup of the call schedule and like the intern year. This was slightly less important because I figure it's kind of going to suck wherever you go, just because like you're going to be working really hard wherever you go. But the difference between 9 months of IM wards for your first year when you're an ophtho resident versus like 4 months of IM wards is not insignificant. And I realize I'm the type of person who would like to get through lots of misery in a short period of time versus like a little bit of misery spread out. And so I preferred programs that had a heavy front load call schedule versus like you're doing call all 4 years, but you do less call over the 4 years. No, I'd rather just hit me hard, hit me fast in first few years, and I can kind of like participate in society for the second half of residency. So I really think you just kind of you have to figure out like what type of person you are, what your preferences are, how you want your life to go these next few years and just go. Of course, vibes mattered, but I think vibes mattered less than I thought they would. And it's because everyone can put a good face forward, especially virtually, especially in a 1 day interview. But very much avoided red flags. There was a program I straight up did not rank, even though I applied there and interviewed there because the vibes were off. And so if the vibes are like really, really off, like they couldn't even pretend for a 10-minute interview, yeah, it's probably going to be bad. But most places can pretend for a 15, 20-minute interview. And so I don't know how much vibes should really matter if they're just like good or lukewarm.
So for me, I try to do a balance of everything I value. I was one of those people who after every interview had a spreadsheet and filled out like my rankings in different categories. And then when I got like the rank list that my Google sheet produced, I didn't even go with it. I just kind of used it to kind of remember what I thought right after based off my gut reactions. And then in my notes app, I kind of ranked each program by different categories. I definitely cared about location a lot. I'm from Maryland and I've been in the DMV my entire life, growing up in Maryland and going to medical school and undergrad in DC. So I was okay with being able to venture out. However, I did want to consider the ease of getting home. The last thing I want to do is be broke. So I don't want, if I didn't have to get on a plane to get home. That was something I valued. And I'm glad I was able to end up in New York where it's just a short train ride. So that's something I considered because that's kind of being able to access your support system is going to be very important in residency. I also did look at prestige a little bit. I didn't put too much weight on it, but I think it's also can somewhat reflect the opportunities that are available at that program and seeing that the program has opportunities that align with my values. For example, I mentioned having interest in global ophthalmology. I'm looking at, okay, which places have more opportunities for me to expand this interest? The same thing with my community service, outreach, mentorship, things like that. And even the patient population that program serves in that city. That's something I consider because I got into medicine wanting to serve underserved populations. Another thing I considered was vibes, especially considering I'm likely to be moving away from my support system. I would want to be somewhere where I feel I can build a family and build a support system. And, being, Black, I want to, make sure I'll be somewhere where I'm supported. And I'm not doubted. And just being able to be in an environment where I can flourish was very important to me. Sorry, I'm looking at my rank list thing. For ophthalmology specifically, another thing I looked at was like the amount of clinical and surgical volume. For example, I think the average number of cataract surgeries that people complete within residency is around 230. So I would rather be at a program that's at or above that average. I don't want to be somewhere where I won't get enough surgeries to feel confident coming out because I honestly don't know whether I want to do academics, private practice, whether I want to do a fellowship. I just want it to be somewhere no matter what route I choose to change or no matter what passion I develop throughout my training, I'm able to have the opportunity to pursue it. So that means, like Dr. Webb was saying, the different subspecialty variation that they have at the program. And it also means the surgical exposure that we have at the program and the clinical exposure. I ended up at a program that has a lot of patients. So I feel like I'll get very good clinical exposure and be able to come out confident. So those are the things that were really important to me with my
Nice.
rank list.
All those are super important. I think you guys highlighted a little bit on call schedule. I feel like as a medical student, you don't know that aspect of it, to be honest. At least for me, like I didn't really look into that because I view like you have no idea. I was like, what's home call? In-house call? You don't know. Like maybe you know a little bit. Oh, what is when you're about up versus you're now? It's just saying some for you, you're like, I just want to go hard junior years. Maybe when you're more senior, I'm just more operating. And so like all those kind of little things, sometimes it's so hard to see as a medical student. So make sure you have mentors. Make sure you have people who you can actually kind of talk to about this. But sometimes this is like hard questions to ask. It's hard for you to go to a program and be like, so how is you guys' call? Everybody's gonna look at you like, come on. And so just make sure you have people who you can talk to about those kind of stuff because I think they're important. Sometimes you taking call twice a week versus once a week, versus 4 times a week can make a huge difference on your life and on your mental health and all that kind of stuff. So look at everything else, but those kind of things are also important just for your well-being. Just my two cents on that one. So, you know, thank you guys again for making this happen. Just last few questions. If you guys could go back and give yourself one piece of advice during this whole process, what would it be?
If I could give myself one piece of advice, it would be to trust my mentors. I had a very hard time believing what they were saying to me because like going into the cycle, not that I don't think they're trustworthy, but because I'm an anxious person, but going into the cycle, they were like, "Look, your app is strong, you're going to be fine, you're going to get interviews at the places that you are interested in, everything is going to work out." And I didn't like trust that that was real. Like I was like, "Of course you're going to say this to me. You're my mentor, like you want me to do well, of course, whatever." And so I think I spent a lot more time being anxious than what was necessary because I was like, "Oh, well, I haven't heard from this program and I'm worried because I really like this program." And whole time they hadn't even sent any interview invites yet. Like I was just unnecessarily worried throughout this entire process because I obviously had never gone through it and I didn't know anyone who had gone through it like in my family. I knew my classmates who had gone through it, but in my mind they were superstars and I was not on their level, right? And you always find these reasons why you are the exception, and I just need you to believe that you're not the exception. If these people are telling you that people similar to you have done this before and they've done well and that you are fitting in this mold, trust them and do not just be like unnecessarily worried, unnecessarily scared, and making the process harder than it needs to
It's a
be.
good advice. What about you, Dr. Oladapo?
So for me, I'm a Christian, so I would definitely say faith is key. This is coming from somebody who actually has had mentors tell them, okay, you're not going to match in my program, but you might match in ophthalmology. So, with that situation, still having faith in myself and taking what the mentor is saying, like at face value and being open to improving. Cause sometimes you are the problem and you have to be mindful of the ways that you can grow and improve and be able to increase your chances. But at the end of the day, really having faith in yourself and prayer is very important. And just knowing that rejection can be God's protection. You don't want to go somewhere where they don't really have the opportunities for you. And where you end up usually is going to be somewhere where that program really saw your value and had faith in you. So being able to just go in with an open mind, apply broadly. I did apply to 77 programs, but you never know where your cards are going to fall. And just having faith that you're going to end up where you end up. And even if you don't match the first cycle, having that resilience and still seeing your worth and being able to come back, reflect, improve, and come back as a better individual and as a better applicant, and just being able to showcase who you are and have confidence and faith in who you are.
Nice. All those are just amazing, and thank you so much for giving that advice. I always tell people just like, run your own race, and don't be too worried about the things that you can't control, right? Like, just think of like, is there anything I can do about this? If there's nothing you can do about it, all you can do is pray. And so with that, I appreciate you guys for making the time. I know I kept you for like super long now, but again, if one person can be encouraged from this, so many gems, I think will be more than enough. So thank you guys. And good night. I stopped recording.